Just this week, we learned Americans' life expectancy saw its biggest drop since World War II, falling by a year and a half. In 2019, life expectancy was 78.8 years. In 2020, it was only 77.3 years. Hispanic and Black Americans saw the largest drops, with a decline of about 3 years compared to 1.2 years for white Americans. The CDC is mostly blaming that drop on the pandemic. Now, besides getting vaccinated, what can we all do to extend our life? We bring in Dr. John Higgins, sports cardiologist with McGovern Medical School at UT Health, to further discuss this. Good morning to you, Dr. Higgins.
Good morning, Melissa.
Can you explain what's going on with this and life expectancy? We have seen millions of people across the world die, so I guess no big surprise here, but it's still a devastating number to hear.
Yeah, it is very devastating, Melissa, because we are always about, trying to have people live long and prosper. So I think we've got two major aspects to this, Melissa. The first is, the COVID itself, the virus, people dying from the virus and its complications. But the other is kind of more of an indirect effect, Melissa, the lockdowns. So the effect they're having on people, people are getting into sort of unhealthy habits at home. So there are risk factors for cardiovascular disease, cancer, and even mental health risk factors for, depression and suicide have gone up. At the same time, there's access issues to medical care. So a lot of them, have found it difficult getting to the doctor. And I think putting those together, that is also increasing the risk that they could die indirectly. So there's a couple of different things going on, Melissa.
And we've seen crime go up and a lot of homicides as well. So there's just, as you mentioned, a lot of stuff going on. I talked to a doctor the other day about people drinking more, and that is making the cancer rates go higher as well.
Exactly, Melissa. Those bad habits, eating to the wrong foods, is smoking, drinking too much. And on the flip side, not doing what they should be doing, which we know is great. That is, exercising more, getting the good night's sleep. There's a lot of Netflix and all of those, they've gone up, skyrocketed, so people are, staying up and later and not getting enough sleep. So those are important things as well.
We know that stress is one of the biggest indicators of life expectancy as well. It can be devastating on your immune system. Do some of these things that you talked about help lower those stress levels, or do we need to take time to stop and just breathe throughout the day and take a break from that stress?
All of the above, Melissa, you are spot on. So we've got all of these stresses on us. It might be the stress of, being at home with the kids for those younger parents, or for the grandparents not getting to see their grandchildren as much as they want, being more lonely. So you've got that stress, but you've also got those stresses from the physical things, not getting enough exercise. That will lower your immune system. Doing too much of the unhealthy things will also lower your immune system. So it is, just basic things. Melissa, I drove past my gym, this week. It's closed, it's gone. So there's a lot of reasons why people can't get out and do what they used to do. So I think really, really important, Melissa, is people are going to need to kind of reinvent themselves a little bit getting out of this pandemic, both with work. I know a lot of works now are going to a hybrid model, as well as with their exercise. So home exercise is going to be more and more important. Doing things like getting some weights or just using something heavy and doing biceps curls at home, doing push-ups, doing some resistance training at home, as well as exercising. So you're social distancing, so, jogging, walking, biking, that sort of stuff, as well as focusing on your diet, making sure you're healthy, getting the healthy sleep, doing relaxation, having one part of the day, Melissa, preferably, when you're really stressed out or before you get stressed out, or, later in the evening before bed, where you do actually do some sort of stress relaxation. Breathing, we know breathing is really important. Doing some breathing exercises can help you with, especially if you end up getting COVID. Of course, making sure you're up to date with your medications and your vaccinations, get your COVID vaccine, okay? And then finally, avoiding situations where you might get exposed to COVID. I mean, there's a lot of people out there who still have not been vaccinated, so avoid kind of crowds. if you're not sure, wear a face mask yourself. That will still protect you. And do the things that you ordinarily do during the pandemic, avoiding sick people, making sure you disinfect, wash your hands, all of the good things. But I think people are going to need to reinvent and change a little bit, but don't be scared. You can do it, and you can still be healthy and get that life expectancy up a bit.
You are such a positive force, Dr. Higgins. Thank you for all of that great information coming out of UT Health and all that you always do.
Thank you, Melissa. Well, you too, and have a great, fun, relaxing day for the rest of the day, Melissa.
Well, you made me want to go figure out how to work out more at home, so I will do just that. And I'll get back to you. All right, good to see you.